Good morning, selamat pagi, salam sejahtera, dan salam perpaduan dari The Leadership Institute for Sarawak Civil Service. Salam Sarawak, Ibu Pertiwiku. Foremost, many thanks for your participation this morning. Based on our registration record, we have received about 221 registration. That's impressive. For now, we have about 92 connections. Surely, throughout these 2 hours, we will see an increase in connection as we go along. But my plea to you this morning, please do not drop out, because you will not know what you will miss. The leadership executive talk is not new by any means. Typically, we would have done it the last few months via face-to-face. We have had many distinguished guests in the past, and we will continue to offer the same to the State Civil Service. But the last few months, you would have noticed we have suspended this event because of the COVID-19 pandemic. And here we are again. But this time, the approach is different. The approach of delivery is different. Many will say, and indeed many have said, this is the new norm. This is the new normal. In my view, this is perhaps the simple switch from face-to-face to webinar. Is a classic manifestation, a simple example of a classic manifestation of the change expedited by the pandemic. I dare say my life has changed, and I believe some of you, your lives have changed. It is a fact. It is a fact. Our lives will never be the same again. COVID-19 has already, in a matter of a few months, completely changed our world. If you take back a few minutes, and really think about the magnitude and speed of what's happening around us, it is remarkable. It is remarkable what we're going through at the moment. It feels like a line has been drawn in the sand between life before the crisis, life now, and life next, the before and after. But for me, for you, for us, we have a lot of questions. What will change? How will things be different? How do I know what would be my priority? How do I know what's relevant for me, for you, and for us? These are big questions, and we'll try and explore them this morning. So let's reflect on this big question together in the presence of Datuk Professor Dr. Awang Bulgiba, Awang Mahmud, from Universiti Malaya, Department of Social and Preventive Medicine, Faculty of Medicine. I had a few words with Prof, as I will call him as we go along this morning. That I'm least the most qualified person actually to introduce our distinguished and most accomplished speaker this morning. I mean, most of you would have read the introduction that we have submitted to you, inviting you to participate. I mean, this is the person that has published more than 100 Web of Science indexes, journal articles. This is the person in 2013 was awarded by the state during Malajra for his prominence in his research. And the list goes on. So colleagues, we in the SCS and colleagues from Yayasan Sarawak that have joined us this morning, colleagues from SCDC that have joined us from this morning, we are so fortunate to have Prof with us this morning. But I would want to change channel. Kata orang, kita tukar channel sekejap. Let's get to know Prof in 2 minutes. Prof, let's get to know you in 2 minutes in a typical Sarawak manner. So we bring everybody home and make everybody feel comfortable at home. Let's do something a bit unusual in most moderation that I've done. So I would remember those days, my nenek would pop up into the sitting room and would have seen new faces amongst my friends. Yang lalu nanya. So this is the way I will ask Prof as well. Kita tu siapa, Prof? Dari kampung ni kita tu siapa mak bapak kita? Sene kita sekolah. Kena banyak orang si dengar. Adanya dengar, ada si dengar kita tu. So Prof, in the next 2 minutes, if you can introduce yourself in the most local approach that you can. Please, Prof.
Okay, thank you very much. Assalamualaikum. Very good morning to everybody. Thank you very much for joining us today. I'm from Sarawak. I'm from Kuching. I live somewhere along Jalan Muhibah, one of those side roads along Jalan Muhibah in Kuching. And for 11 years, I went to school in Kuching, St. Joseph's Primary and Secondary School in Kuching. My parents were both teachers. My father is still there in Kuching. He's about, I think, 89 this year. My mother passed away some years ago. My father used to teach in several schools. I think Sekolah Rendah Gresik, and eventually ended up in Batu Lintang Teachers Training College. My mother used to teach in St. Teresa's Secondary School. So some of you may or may not know both my parents. They're both teachers. So after school, I went to UM. I went through Asasi Science. I wanted to do medicine. There was no scholarship to do medicine overseas at that time, so I went to UM. And after UM, I worked in Ministry of Health for about 10 years, and then after that, I joined UM as a lecturer. And I've been in UM now for about 22 years. So it's been some time. You've been in UM. Yeah.
Permanent resident, Prof.
More or less.
More or less.
The thing is, when you join university, you tend not to leave for another university unless there are very compelling factors, because you have built up your research base and you build up a team in that particular place. Yeah, that's why yeah.
Your collection of accolades, I call it, is impressive, Prof. And I think you've done UST Malaya well, I think, to put it on the right path, I think, in terms of the many things you've contributed. I just kind of recall some of the research that I did before we spoke last week. And one of the things that struck me most was I was telling my parents-in-law this morning that, hey, I'm going to facilitate or moderate this forum. And how do I tell them who am I talking to? Ano sidaknya anu involved yang decide whether we should have MCO or not. That's the guy, I said. So then he said, yes, tell the guy thank you for doing what he has done. So I think you have done enormous for the state. So without further ado, Prof, we'll move into the proper session itself. To all the people online, we have 104 now that have connected. A brief introduction. My name is Ismail. I am the sitting CEO for the Leadership Institute of Sarawak. You will bear with me this morning, as I will be with you for the next 2 hours as we go along. And in terms of protocol, as you start reflecting on some of the facts, the conversation, please submit your questions, submit your queries. We will pick it up. We will try to cover as many as we can during the 2 hours that we have. So, Prof, this is how I will kick it off, and we'll hand over to you for the next few minutes. Now, if I were to put it into a question, the question that I have really, I think on behalf of the 109 people now that have connected, help us make a sense of what's going on and what's going on with regards to our future after COVID-19, or even now we will say it is not over, we're still during that period. So actually it's helping us make a sense about what we're going through. I will hand it over to you, Prof, please.
All right, thank you very much. Let me start my presentation here. I hope everyone can see my slides. Is that okay now?
Yep,
Yes?
it looks good from
okay.
from outside. Yeah.
All right. I'm going to talk about moving forward post COVID-19. That's the title of my presentation. And basically, I'm going to divide this into a few sections. But let me just take you through a few basic facts about epidemics, pandemics, and epidemiology, because I realized that most people attending this talk would probably not have been trained in public health. So perhaps a few points might be in order so that people can understand where I'm coming from. Now, a lot of people don't even understand what epidemiology is all about. Epidemiology is a type of study. It's a study which is, of course, scientific, systematic, and data-driven. And it deals mainly with three things. The first is the distribution of diseases, the frequency, the patterns, and so on. And by patterns and all, we can see it over time, whether it occurs in some types of populations, more common than others. And determinants, of course, the causes, the risk factors of whatever health-related states that we are talking about. Not just diseases, of course. In specific populations, it can be a neighborhood, it can be a school, a city, a state, a country, or globally. And the third, which is what epidemiologists also do, is applying this study to the control of health problems. This comes from the book called The Principles of Epidemiology in its third edition. Now, so epidemiologists not only study, they analyze, they help to intervene, and they advocate. They advocate the solutions to societies, and they try to educate the population on about diseases. So things like the epidemic curve, you can see in the slide here on the upper half of the slide, that's the epidemic curve. So you can see when the disease starts and when it's slowing down, it's spread, and it seems to be tapering off, and so on. And then at the bottom half of the slide, you can see the distributions of diseases, for example, which countries are most affected, and within a country, which regions are most affected. So the ones that you see, I've taken it from Wuhan and from China, and of course the world, just to see how this COVID-19 pandemic started. Now, there are many types of studies that epidemiologists do. They can be grouped into four main types. Etiologic. Etiologic means we find out what the causes or determinants of diseases are. And diagnostic studies, what kind of tests work best in terms of accuracy, sensitivity, specificity, and so on. And prognostic. When people get a disease, what causes someone to survive or someone to die, for example, or someone to progress from one stage to another stage. And lastly, of course, therapeutic, what kind of prevention or treatment options work best. So these four main groups of studies. So as you can see, epidemiologists are kept busy. They study all sorts of things. And with these studies, I think people make decisions on what treatments to adopt, for example, how best to diagnose something and where this disease spread. Now, an epidemic, probably people know by now what is an epidemic, but the formal definition of an epidemic is in occurrence of an illness or specific health-related behavior, not necessarily a disease, or any other health-related events clearly in excess of normal expectancy. So when we talk about normal expectancy, what do we mean? Does it mean that it's a single case or 1,000 cases and so on? Now, if there is no such disease, the disease is new, even a single case is an epidemic. So when you say it's an epidemic, it is relative. It is in excess of normal, whatever we clearly think is normal. Now, what is a pandemic? A pandemic is an epidemic which is occurring worldwide over a very wide area. So this crosses international boundaries and so on. So an epidemic that spread throughout the world is called a pandemic. And managing this epidemic or pandemic is just like fighting a war. So you need an army, you need strategies, and so on. So a few basic numbers. There are now more than 14 million cases of COVID-19 throughout the world. And I'm just focusing on Southeast Asia and plus South Korea. So the largest number of cases is Indonesia. That would be expected because it has the largest population within ASEAN. The next is the Philippines. It's also a very large country. It's about 110 million now. And surprisingly, the third is Singapore, simply because Singapore does more testing per capita than any other country within ASEAN. It's about triple the rate of Malaysia, in fact. And then the third is Malaysia, and then Thailand, and then of course the others which are lower. For example, Brunei has had no cases for more than 70 days now, I think. Now, as far as death rates, we are talking about rates, not absolute deaths. The death rates in Southeast Asia, Indonesia has the highest death rate, partly because I think the number of tests they're doing is probably low. So the number of cases that they have discovered are the cases which are already relatively severe, and so their death rate is higher than anybody else. The death rate of in Thailand and is higher than in Malaysia, but it's very low in Singapore. But this is death rate, not absolute number of deaths. Now, talking about Sarawak itself, I got this from yesterday's figures. There have been a total of 607 positive cases in Sarawak, and the recovery is about 554, which means about 90% have recovered. And there have been a total of 18 deaths in Sarawak. Now, the death rate in Malaysia is about 1.4%. The death rate in Sarawak is about 3%. So this is higher than the national death rate for COVID-19. It's about twice the national death rate. Now, we have gone through several MCOs. We started off with the first MCO, which was on the 18th of March. It lasted until the 3rd of May. This was highly restrictive, as everyone knows. Then there was a conditional MCO, which began on the 4th of May to the 9th of June. And we are now in the recovery MCO, where almost all restrictions have been removed, and this is supposed to remain until the 31st of August. Now, all these MCOs have been based on the application of two acts at the national level, Act 342 and Act 344. The first one is Prevention and Control Infectious Diseases Act 1988, and the second one, Act 344, is the Police Act 1967. But it's also the Sarawak Protection of Public Health Ordinance 1999, which is applicable to Sarawak, and which is, I think, in use also in Sarawak. Now, overall, the death rate for COVID-19 for Malaysia appears to be much lower than the US, the UK, and other European countries. And there have been several reasons which have been speculated why this is so. One could be, of course, the demography. The thing about Malaysia is that the proportion of older population is lower than in the US or other European countries, certainly lower than Japan or Korea. There's a second explanation, which has not been scientifically proven, that BCG vaccination somehow confers some kind of a protection against COVID-19 severe disease. So the death rate in Malaysia has been lower. And of course, Malaysia experienced in contact tracing because of ongoing disease outbreaks. We've had SARS in the past, we've had a scare with the MERS coronavirus and so on, and the Nipah virus. And because of this contact tracing, and I emphasize this, because of the contact tracing, the prevention there, the health facilities have not been overwhelmed. So inpatient care has been of a relatively high standard. So the death rate has been lower.
Prof,
yeah.
if I may make a short request, Prof.
Yeah.
We are detecting the fact that we are not able to see you. So would you be kind enough to click on your video, Prof?
Oh, I see.
Kami rindu nak nangka muka kita juga.
Oh, I'm sorry. I did not realize.
Your voice is very clear, but I think we're detecting the fact that your video is not switched on.
Okay.
If you can do that for a while, yeah.
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 Hang on. Let me see.
It's the button, I think, next to the microphone.
Next to the microphone.
Yeah. There is the button there on your screen. It will
on
be
the right
on
side or the left side?
Yeah, if you look at the screen, there is a picture of a mic, and click on the video. That's it.
Hang on. Oh, yeah. Okay. So sorry.
Okay.
So
Yeah. Thanks. Carry on.
I'm very sorry. Yeah. Okay. Now, people have talked about reproduction numbers. Our current reproduction numbers, which is a measure of how many people get infected by a person who is infected, is now less than 1, which means that the disease occurrence in the community is low, and then of course our death rate is low, as I've said just now. But post MCO, we need to do better. We need to ensure clear policies and actions, and we need to maintain a strong health system and a socially responsible population, as well as good governance in order to achieve the right balance between public health action, economic survival, and social equilibrium. And we certainly need to ensure marginalized and vulnerable populations are taken care of. So there's a lot that we need to do post MCO. Now, how will this pandemic play out? This is a question which I've been asked several times, and I've had to explain how this will play out. Now, there are four main ways that the pandemic will play out. One is the existence, whether somebody has managed to find or has not found a vaccine. The second one is treatment. And the third is if there is a possibility of intermittent outbreaks, then we'll have a intermittent suppression, what I call a dynamic MCO. And of course, the fourth is a virus mutation. Let me just explain a bit what this means. Now, vaccine trials, because before a vaccine can be used in the population, it has to be designed and you have to carry out a trial. Now, the design of the vaccine is more tricky than ordinary drug trial. And there are always ethical issues about challenge tests in a vaccine. Because you must remember that a vaccine is for prevention. It is not for treatment. So trying to test a vaccine to see whether it actually works in preventing something can bring about ethical issues. So this is where also epidemiologists advise people about these trials, how to carry these trials out effectively. So let me just give you three different scenarios about a vaccine. The first scenario would be an effective vaccine is found. Now, the earliest this can happen, despite all the expedited trials that is going on now, is at the end of 2020, which means the end of this year. There are a lot of new technologies being tried out for vaccines now, which have never been used before. For example, DNA vaccines, mRNA vaccines, and so on. So trying out new technologies, of course, means that you carry the risk of not working at all, or it causing other unintended side effects. Now, if a vaccine is highly effective, it should prevent transmission, it should prevent infection, and you will have effective antibodies. Every vaccine is now on a fast-track process because they have to try to get this vaccine possibly by end of this year or by next year at the latest. And anything to do with a fast-track process, you'll need caution because there are always dangers of fast-tracking anything. And when you have found a vaccine, then you will have to think about the volume of production to cater for the billions of people out there all over the world. Now, that's the first scenario, if an effective vaccine is found. The second scenario is if a partially effective vaccine is found. Now, when you say partially effective, you say it does not completely prevent, but it reduces the effect of the infection. So, for example, it might reduce infectivity of cases. So people might find it difficult to infect others. This is like the common cold. So it can be done. Again, whatever thing that you do, it will be a fast-track process, caution is needed, and so on. The third scenario is that there is no effective vaccine, and this can well happen. Now, if this happens, by next year we have found no effective vaccine, the search for the vaccine will go on unless the virus itself mutates to become less virulent. Now, if the virus virulence remains the same or increases, God forbid, then the RMCO will be the new normal. If the virus becomes less virulent, then the search for the vaccines will likely slow down or even stop because people will find it unnecessary to have a vaccine at all. So there's three different scenarios just for vaccines alone. For drug trials, there are many things that we do in drug trials. Epidemiologists help design trials, carry out, analyze these trials. So I won't bore you with that. Again, there are three different scenarios for drugs for effective treatment. If an effective treatment is found, it stops the infection and transmission, the disease becomes treatable. And the drug is likely to be fast-tracked for approval. But you have to be very careful to make sure that you don't have virus resistance, which has happened in HIV, for example, that the first drug which people found AZT to treat HIV. Over time, virus resistance developed to that drug, and you'll have to have a second generation of drugs and a third generation of drugs. And then you have to produce lots and lots of drugs to cater for all the billions of people out there. Now, if you don't have a completely effective treatment, but you have a partially effective treatment, then maybe you will have very low death rates and very few complications. So, but if it's partially effective, it may still cause our healthcare facilities to be overwhelmed. Now, the third scenario, which is very unfortunate, if there's no effective treatment. Now, the search for this treatment will go on unless the virus becomes less virulent. So, if the virus virulence remains the same or increases, then RMCO will be the new normal. If the virus becomes much less virulent, the search for the treatment will likely stop because it becomes not a very life-threatening disease. So 3 different scenarios just for treatments. Now, what about the third group of scenarios, intermittent outbreaks? The intermittent outbreaks, if it happens, and which is already happening in some countries, then we'll have suppression by intermittent MCO, dynamic MCO. So we've seen that happening in Melbourne, for example, in Hong Kong, for example, and in Leicester, for example, in England, for example. They've had to have an intermittent kind of MCO. But the economy will need to be kept open to avoid a prolonged recession. And the intermittent outbreaks can be controlled, but many occupations will be affected. And this will affect, I think, everybody throughout the whole world. And then the last scenario, I don't know whether this will happen. The virus mutates to become a less virulent form. There have been many mutations of this virus which has happened throughout the last few months. And there is one significant mutation which scientists believe has made it more infectious than ever before. If it becomes less virulent and effective treatment is possible, small outbreaks can continue to occur, but it can be controlled. But if it becomes more infectious or more virulent, then without effective treatment, we'll be having problems in the future, that's for sure. Okay. Unfortunately, if the virus mutates to become a more virulent form, this fourth group, this mutation, then we will never be able to return to pre-pandemic routines, that's for sure. Because MCO will be reinstated, there will be an intermittent MCO, economic recession will be prolonged, and we will have this grim scenario. Unfortunately, we do not know whether it will mutate to become more virulent form. But what is for sure is that the virus now, prevalent now in the US and in Europe, is very different from the one which started in China. So the infectivity of the virus apparently has increased. But whether it is causing more severe disease, it is still under research, under study. And whether this will happen, we do not know. Hence, the race for effective treatments, the race to find effective vaccines is still going on. And it is fueled not just by the fact that we need to have this kind of effective treatment or effective vaccines, but there are huge commercial returns for whichever company which manages to find an effective vaccine or an effective treatment. It is likely there will be several types of vaccines which will be used throughout the whole world, because no single vaccine, I think, can cater for the billions of people throughout the world. So I talk about the pandemic as being a war. Now, it is a war, and we have to win this war. So we look at it from the perspective of trying to win something and trying to do something after the war is over. Winning a pandemic war takes a lot of planning, training, preparation, perseverance. Sometimes you have to think of new strategies along the way. And public health and epidemiology is dedicated to such large-scale battles. Because it's not a battle to save one person or to save 2 persons. It's a battle to save entire populations. So winning this pandemic war is a large-scale war. How do we know if we have won? Now, in any conventional war, it is easy to identify the victor in a war fought with guns and bullets, and victory is remembered or celebrated through ceremonies. But it's a lot harder to identify the victor in a pandemic war. There are no ceremonies. There is no parade to mark victory in a pandemic war. But it's still a war. And unfortunately, people, because there are no ceremonies, people tend to forget that they've been in a war. For example, there have been no ceremonies to mark the end of the Spanish flu pandemic of 1918, for example. Yet that was a pandemic which killed 50 million people throughout the world. So can you imagine that? You know, that's just like the First World War, for example. Now, this Remembrance Day which remembers the end of the First World War. It is celebrated, I think, the 11th of November at precisely 11 a.m. in the morning. 11th of November. Now, the First World War, of course, is fought basically in Europe. It wasn't fought in the rest of the world. It was called a World War, nonetheless. So this is Remembrance Day, which marked the end of the First World War. This is the ceremonies to mark the victory in the Second World War. In Europe, it's called VE Day, Victory in Europe Day, to mark the end of the Second World War. So again, this is marked by a ceremony. So people remember that was the end of the Second World War. And we still remember to this day about victory in the Second World War. Unfortunately, like I said, victory in a pandemic war is never celebrated like Remembrance Day or VE Day. Victory in a pandemic just means return to normality. But like world wars, victory in a pandemic war should never be taken for granted, because this may not be the last pandemic that we'll see. And there are many lessons that we need to heed from this particular pandemic. And with climate change, with many things that we are doing now, it is likely that that we will see other pandemics in the next decades. Now, there is no better adage in medicine than prevention is better than cure. Now, this is especially true when there is no cure. And the only way to protect yourself in a pandemic is prevention. So the job of public health professionals like myself is to prevent people or the public falling sick and ending up in an ICU, just like this picture. So if our ICUs are overwhelmed with patients, we know that we are in trouble. And what we hope to see is something like this, which is an empty ICU. So one depiction of victory in a pandemic war is an ICU with no patients. So we know that we have managed to stop people getting sick and ending up in a hospital. So,
Prof, maybe I can allow me to interject a bit. I think there's one part there I think which is quite a sense of which is quite prevalent in our society for the moment.
Right.
There is this feeling, and probably I think there must be this thinking in many of the participants this morning along the lines of, if I have been treated before, is there an opportunity to actually, will I develop that immunity, or will I be, still a potential target of, another round of attack? So in other words, yes, recovery doesn't mean permanent. I still have to, do I continue to socialize? But there is that sense. I think there is that sense. I think I've been to a couple of forums. There is always this question that's coming through again and again. Bolehkah kami kena jangkit lagi tu? Kami udah kena swab, udah kena test, udah pergi berubat. Can you just clarify that piece a bit?
Okay. Recent research on antibodies which are produced after COVID-19 infection shows a declining level of antibodies after a few weeks. So within about 2 months, the level of antibodies may not be very high in that person. So there is a possibility of reinfection. That's one. Secondly, you must remember that this virus, big and RNA virus, is mutating all the time. And the possibility that the virus has mutated to become a more virulent form, or has mutated such that the antibody cannot fight it off, is always possible. So, for example, in dengue, that has happened in dengue fever, the dengue virus. Can a person who has been infected by dengue get reinfected by dengue? And the answer is yes. There are at least 4 serotypes of dengue, and the 4 serotypes keep on mutating all the time. So you have a wave of 1 serotype. When it's over, the next serotype comes along, you're not protected, you can get infected by dengue fever again, because the serotypes are a little bit different from one another. So if the virus becomes mutated and your antibodies don't work against it, then it's going to be a problem. We hope that research will determine whether the memory cells which happen in a person as a result of infection can then kick in when there's a second infection occurs and produce antibodies which can fight off the virus. If the correct kind of antibodies are produced, which can identify the target virus and regardless of the mutation, then we are okay. So at the moment, the jury is out on this. We do not know whether how well a person can be protected after an infection, but my guess is probably at the moment not very well. So which means we are still in danger of getting a second infection. Yeah. Can I go on? Yeah.
Please. Thanks.
Okay.
Thanks for the clarification.
After a pandemic, there are, people always see a pandemic as being a tragedy, but I always think that behind every cloud there is a silver lining, and this pandemic offers us the opportunity to reset, to do a rethink on how we do things, and perhaps prepare for the future. It's also a reminder how fragile life is, on this planet of ours. That an organism which cannot survive without a host cell can cause so much misery to millions of people. There are more than 14 million people who have been infected by COVID, and there are more than 600,000 deaths throughout the whole world. So opportunities after a pandemic, I believe, are the silver lining behind this cloud. Now, after the pandemic, we will need to do a lot of studies. How bad was the infection, which my group, I'm leading a group now, looking at how bad infection was, which population groups proved to be more resilient, what lessons can we learn from this, and what can we do to plan for future pandemics. So I look at this as opportunities for Sarawak also. One, for a pandemic resilient Sarawak. I call this a pandemic resilient Sarawak. And I would classify them into three things: the rise of machines and AI, the adoption of in everything, in work and life, a more efficient food supply chain, and the rise of blended learning and opportunities for a mega biodiverse Sarawak, as well as a new pandemic preparedness plan. So these are opportunities that I see. People might see this as more work, but I see this as opportunities. So pandemic resilience needs to be in everywhere. It's not just, of course, in the economy and so on, but we need to have a pandemic resilient civil service, for example. We need to have a pandemic resilient education system, health system, economy, and the security of the country. Can
you elaborate that piece again? The slide before.
Yeah.
When you talk about the resilience of civil service, let's take the civil service. I think most of the participation this morning are from civil service. Yes. What does that mean? An example, Prof, will help us to put it into context and make it relevant for most of us. What does that actually mean? Yeah,
the pandemic resilient civil service, I would say it's a civil service which is not concentrated in a very small area. Because a civil service which is concentrated in a very small area means that it is unable to stop any pandemic from disrupting the entire civil service. So you need to have not a big civil service, but a lean and a technology-driven civil service. And you need to have a civil service which can work on a dispersed mode, meaning that they be dispersed throughout. So, for example, you have a team A and a team B for this particular office. So if team A gets infected, then everybody gets quarantined, team B is still able to function. So you'll have to have the usage of technology to its maximum. And this should be part of the pandemic resilience civil service business continuity plan. How do we function and continue to maintain the critical functions of a civil service should a pandemic happen? This is, I think, something which I'm sure the civil service must think about. Right? So, what do you mean by returning to normal life? For example, when you talk about returning to normal life, people talk about exit strategies. Now, exit strategies is not when you're completely off from pandemic measures. it's trying to return to normality. So it means it may not be completely normal, but there is some semblance of normality. So exit strategies means a return to this some semblance of normality. And the exit strategies must include what opportunities that we can plan for post-pandemic and include how to watch out for signs of disease resurgence. I've been trying to advocate certain things, measures, for example, how to watch out for signs of disease resurgence. I don't think this has been completely taken up by the government, but we're trying. My group is trying to propose certain things, which I think can be done. So return to work means that, as you can see here, that's Malaysia Airlines check-in counter. So it would mean people being able to fly. As you know, flights they are vastly reduced now. Production maybe in the factories can be back to almost normal or normal. Supermarkets can operate. Perhaps this might happen. But as you can see in the photograph, these are actual photographs of staff during the MCO, people wearing masks and so on, trying to do work. So there may be some return of work which is expected. I mean, we can't be on MCO mode forever. It's really bad. But for pandemic resilience Sarawak, there are a few things which I need to mention. This is the rise of machines and AI, nothing to do with the Terminator movies and so on. But the fact is, we need to have and we need to move towards automation in many of the things that we do. Whether it's in the factories, whether it's in healthcare, whether in distribution systems and so on, we need to move towards automation. So what are industries that will be more resilient in pandemics? The more resilient industries will be the industries which use a lot of robotics. And I think the pandemic throughout the world will accelerate the adoption of driverless transports and automated drones. There's always a problem with driverless transports and automated drones, is that the legislative framework, for example, the regulatory framework doesn't yet allow. There's no country which has adopted a level 5 automated driverless system, for example. But it's going to come, and the pandemic will accelerate this. The rise of artificial intelligence is going to be prompted by this pandemic too. So intelligent chatbots which can mimic humans, for example. And automated analysis, I think, will replace human-driven analysis because it will be done repeatedly, and the AI algorithm, the machine, will learn how to improve its own analysis as it goes on. However, and this is the thing, our problem in Sarawak, I think, as in many other states, is that most of the businesses in the state are micro enterprises which cannot afford automation. We know that. As a whole, in Malaysia, 98.5% of all businesses are SMEs. And those SMEs mainly are very small. They are classified as micro enterprises. It's not really a small enterprise, it's a micro enterprise. So they don't have much capital. Their business model is based on low costs, producing very small items, and the turnover is not very high. So there'll be three keys here. One is that we have to move away from a labor-intensive kind of industry to industries which can afford automation. So this has to be deliberately planned in the economy for that to happen. Secondly, to support that, you will have to have human resource capacity building, either school or vocational level onwards, in AI and robotics to enable move to automation. You don't necessarily need a university education to enable a move to automation. You don't need to, because there are a lot of things that you can do at the vocational level which can allow you to operate robots, for example. And it is necessary for the government to assist micro enterprises to move to automation because they cannot afford it. In one, they do not have the knowledge. Number two, they don't have the capital to afford automation. But if we can do that, then perhaps we can increase our productivity as a result of moving towards automation. So we are not looking at low-cost labor anymore. Wages can go up, but the automation will increase the productivity. But it is capital intensive. That is the problem. So capital intensive automation can only happen if the governments promote and assist micro enterprises, especially micro enterprises, to move to this automation mode. Another part of pandemic resilience Sarawak is adoption of electronic, everything in work and life. And WFH is an acronym, I think, which is being used in many places now. It's working from home or work from home. However, of course, WFH is not as easy as it sounds. We know that when you work from home, distractions abound, and technology challenges remain for very remote areas, which don't have access to high-speed broadband and so on. But we need to accelerate the adoption of this. E-government, e-commerce, even e-parliament. I've gone on record to say that we have to think about even e-parliament, for example, and e for everything. The technology is there, but we need to facilitate the move to this e-everything. Of course, these challenges might happen like this, as you can see, with children at home and all that. I find it difficult to work. And even this cat, I think, is bent on distracting the owner, getting attention. So these are challenges of some of the challenges of working from home. People are beginning to go back to WOS, work on site. But in future, in my opinion, and during the MCO, I've come to realize one thing. When I was working from home, it reduced my movements and time wasting. And I didn't have to travel, spend time on the road traveling. It actually increased my efficiency in the sense that I could do more work in 2 hours, because rather than spending 1 hour traveling, I could just do all the work in 2 hours. Of course, WFH has its issues, as you can see from this slide. There are other distractions which can happen. Instead of working, you may be tempted to do other things. It's just a cartoon. And of course, the children, like I said just now, so people might be even tempted to tape up their children and say, okay, don't disturb me while I try to work from home.
I have a question, Prof.
Yeah. Yes.
Just trying to interject it a bit, sure. just to change the flavor a bit. Are there any work or are there any research that you have come across? Through my conversation across the many forums that I've been, the concern around what I call mental health.
Yeah.
Typical example of, I met a group of friends that says, I miss the smell of perfume. I miss the smell of my iron shirt. I miss the smell of my tie. I miss the getting up every morning. Is this something that's being monitored? And how will that impact productivity to some extent?
Yeah. Because this is very new, working from home, it will affect in a sense that there's a sense of social isolation, because human beings are very social animals, in the sense that we need to interact with people, we need to talk to people face to face, and sometimes using internet connection doesn't really cut it. It doesn't really give that sense of being personal, up close. But I think the mental health issues, according to one study which has been carried out, perhaps a little bit exaggerated at the moment, because people thought that it will affect a lot of people, this social isolation. But people are adaptive animals. So again, being adaptive organisms, they adapt to working from home, and when it becomes normal, then people think, okay, oh, actually, I could have done that before. The same thing with when I discovered that my own department, we were switching to online learning before the MCO started, as a part of our own business continuity plan. And we thought that we'll do 100% e-learning for some subjects, in fact. And so we did. When we did that, and when the MCO came, we had no problem working from home, because we were already doing that before the MCO. And after the MCO, the initial MCO was lifted and we could go back to work, and then we missed doing the teaching from home, because we thought, okay, actually we can do this, and instead of spending half an hour traveling, we can just teach the students and then do something else, take a nap or something, and then continue doing the work. But working from home did not mean that we reduce our productivity. And working from home meant that we also became busier than ever before. But there was still that sense a little bit that we miss seeing other people. So that can happen. Some people who are very social, for example, will say that, okay, I missed actually meeting other colleagues or students and so on. So that can happen, but there haven't been really extensive studies on this. I've remarked that we need to look into the studies of this social isolation feeling, that people have because of working from home.
No, I think you made a very interesting point, Prof, which is, I think it's a very strong indication that our sense of what a community has changed now.
Yes.
We talk about community now behind closed doors. We prioritize who do we want to see. And we prioritize our meeting through Zoom. What could be email these days could be Zoom. So I think the sense of community, no doubt, has evolved drastically. And I think I will leave with these questions again in terms of from where we are now. I think we've gone almost an hour in terms of listening to these very interesting facts that you've presented. From where we are now to where we are going, do we take it in terms of evolution? Like most things happen, we have the industrial revolution, we have everything else as an evolution, or this is the time now for all the unfinished work that we have to take that leap of faith now to do something different, because your slide talking about opportunities, talk about that leap of faith that we have to take.
Yeah.
Maybe in the next few minutes, Prof, you can make it a bit relevant to us in terms of where is that leap of faith that we can take in the context of civil service, for example.
Okay. So the thing is, the civil service needs to change the way that it's operating now. I think everybody has accepted that electronically working civil service is the way to go. But it may change the way that we have to we think of our processes. So those processes which depended on signatures, for example, depended on us meeting physically people and so on, will have to change. Those are the rethink that we have to do. Now I'm going to hurry this up because I think we've got quite a number of slides left, and then we'll be running out of time. Just mind if you don't mind. Yeah. Okay. You know, when I talk about automation, we are not just talking about automation as robots, you can see, not physical robots, but we're talking about AI robots. So there's already moves in big companies to replace people with robots where possible. So Microsoft, for example, wants to replace journalists with robots, for example, because these robots can look and scour the web for news, the internet for news, and put it together and try to triangulate which news looks possible, not possible, and just the editor to pick the most relevant news. But the key to all this E for everything, unfortunately, is a very fast fiber optic network, and there's no way around this. People talk about 4G, 5G, but this is just last mile connection. We need to have fiberization, and we need to have backbones which are in the order of terabits per second. If we don't invest in fiberization, whatever 5G connection that we set up, those are wireless for the last mile, it's not going to work. The good thing about fiberization is that you don't have to replace these fiber cables every few years or so. They last a very long time. And you just need to upgrade the switch hubs at either end, for example. But with the E for everything, portals for everything need to be updated always. And I have to point out, this is badly out of date. I got this from the Sarawak government website. This is the portal on connections, for example. This needs to be done regularly, and this seems to be about 9 years out of date. So we need to be on top of these kinds of portals. Now, another thing about pandemic resilience Sarawak, which I think the government has to think about, is a more efficient food supply chain. It's always a concern during a pandemic because as a country, Malaysia depends a lot on imported food. So the questions will be like, does Sarawak have enough food? What are the alternatives that you have? Because nutrition affects the immune system. Any ability to resist infection is dependent on that immune system. So if a pandemic causes disruption in the food supply chain, there will be hunger and possibly famine. And this will affect our ability to deal with any pandemic. So we need to ensure future food security. And the nearer the food producing areas are to population centers, the better. So for the future, even though this seems counterintuitive in a state which is very large, more than 100,000 square kilometers. But the use of urban and vertical farming should be considered where cheap power is available, because a lot depends on cheap power. So, for example, when you talk about vertical farming like this for vegetables, for example, you can plant just about any type of vegetable that you want, including temperate country vegetables, in this kind of environment, and it can be planted quickly and transported to population centers. But they have to be close to population centers, but they do need a lot of power. Power in terms of operating this, it can be using robotics, ultraviolet rays instead of sunlight. Can have powered the nutrition, water supply, and so on. So you can produce a lot of food in a very small acreage and have it transported. Another thing that we have to consider is automation in agriculture. Sarawak has a lot of land under agriculture, oil palm, for example. But it's a source of concern when the workers are mainly migrants, for example, and workers can fall ill. So replacement of migrant workers with automation should be considered where possible. And this is already being considered by large companies, because they know that they cannot go on depending on migrant workers when this happens, right? So there are a lot of sites. We talk about agriculture of the future. These are some of the sites that you can have a look at. And the use of Internet of Things, for example, IoT in tech, the use of robots and digital farming, for example. These are just some of the sites that I can see, promises things which are interesting. And blended learning, I think we have to consider blended learning. Now, e-learning was forced on us because of MCO. This is not carried out consistently in schools and universities. Some school teachers have responded well. As we return to normal schooling, we'll have the opportunity to optimize blended learning. And I think when we return to normal schooling, we should not be looking back at just face-to-face learning. We should now be looking at blended learning, meaning it's a combination of face-to-face as well as online learning. So in cases of pandemics in the future, then we can just switch to fully online learning while, maybe minimizing or reducing the face-to-face learning. Now, this is taken from Perlis, which is a very small state, the smallest state in Malaysia. They've been very active in putting up e-learning during the MCO. So I took this from some of their sites. Okay. Now, there's another opportunity for Sarawak, which I can see, and which I think the government, the civil service need to think about. The opportunity for using this mega biodiversity in Sarawak. Now, this pandemic has shown how far behind the whole country is in producing its own drugs and vaccines. Unfortunately, our drug companies in Malaysia are basically in the fill and finish mode. They do very little research. There is no human vaccine production in Malaysia. No human vaccine production. There are vaccines for animals, but none for humans. And then there are hardly any drugs which come from Malaysia. Yet the country is one of 17 mega biodiverse countries in the world. And the state of Sarawak accounts for a large portion of this untapped biodiversity. So it should leverage on this. So what should we do? We know all these 17 mega biodiverse countries. We know that a lot of the species, for example, come from Sarawak. For lizards alone, for example, 80% of the lizard species in Malaysia come from Sarawak alone. The snakes, almost all the species come from Sarawak. Amphibians, there are 160 species. There's hundreds and hundreds of species of which tells us, and these are the ones which have been discovered. There are others which have not yet even been discovered, and this needs a lot of work. But we have not really exploited this in our jungles and forests. So all these can be turned into medicines of the future. But in order to do this, we need to think differently. So we need to prepare for this pandemic in a different way. And I think it is time for us to relook at the pandemic preparedness plan for the state, because for the country itself, we have been very lucky. It could have been worse, but we can certainly do better. And I believe that some of the success that the country has had in dealing with COVID-19 has been down to just providence and sheer good luck. We didn't make use of technology to the fullest extent. We didn't really analyze our data properly and act fast enough in the early stages of the pandemic. Now, for the State Civil Service, health is on the federal list, but Sarawak has a specific ordinance on public health. This is the Protection of Public Health Ordinance 1999, amended in 2008. Despite this ordinance, Sarawak is not able to manage this pandemic holistically. So it needs to find a way to be a part of future pandemic management. And unfortunately, according to the National Health Mobility Survey 2019, which is the latest one, non-communicable diseases are rising in all the Malaysian states. We don't really have the figures for Sarawak yet because the report, I think, is not out yet. And unfortunately, non-communicable diseases increase the risk of dying in a pandemic. And in COVID-19, we know that whoever has a non-communicable disease is going to have a problem in this pandemic, and the risk of dying is much higher. So I would suggest, this may be controversial, that Sarawak needs to have more say in public health. It's a federal list, yes, but I would suggest that perhaps it may be put on the concurrent list for certain public health matters. And the state should demand that that data sharing be made compulsory under this concurrent list. And I would suggest that Sarawak set up a good research center, which focuses on three things. One, the epidemiology, because you need to prevent and control diseases. And there are many diseases still prevalent in Sarawak. I think rabies is still not gone away yet. But this needs data sharing. Secondly, and this is scientific, in lab-driven in nature, diagnostics. Diagnostics, Sarawak has the expertise, I think, to come up with its own diagnostics for certain diseases, which can be done quite quickly. These are low-hanging fruits. And thirdly, which is a long-term kind of thing, Sarawak needs to make use of its biodiversity to enter vaccines and treatments. It takes time and money to build up, but the returns are enormous if done correctly. Right? What are the risks of failing? If we fail to adapt and innovate, then risks will emerge. It will not be resilient. We will be even less prepared for another pandemic. This pandemic offers us the opportunity to plan and do things differently. So if we don't do things differently, I'm afraid that we won't be prepared for the next pandemic. So I end here with Sun Tzu's quote about planning. Victorious warriors win first and then go to war, while defeated warriors go to war first and then seek to win. I think that's about me for the presentation. I think I'm open to questions.
Thanks, Prof. A lot to digest, I must say. A lot of things resonates very well with the effort of the state, especially we look towards the biodiversities, the opportunities in agriculture. Kinds of bring to mind the Rampangi of this world, smart agriculture that we're looking at, and many things in terms of what we need to do. The question will always be, how fast do we take charge, or how fast do we seize this opportunity becomes, I think, in terms of the capacity that we're looking at. I want to go back to something more basics, Prof, just to something that I see, I think we see, something that has been victorious. In other words, I think I follow your Sun Tzu slide, which is victorious warriors win first. I think there's something that we must actually allow ourselves to feel proud of. And I think it is the fact that to flatten the curve, to flatten the curve, I think we in Malaysia, in Sarawak in particular, have played our role very well. I think that requires an enormous teamwork at every level, nationally and locally. And we have successfully done that. We have stopped the virus from spreading. Now, I'm trying to twist that point of teamwork on its head by asking this question. Is this an indication from sociology? Is this an indication that we are in a society that's matured now, that we can cooperate for a greater good that will impact our future? So will that value that of social effort that we have, how do we tap that, Prof? How do we tap that value of social effort by all of us playing that team role, be taken to actually seize this opportunity in terms of going forward?
Okay. The flattening of the curve is commendable, but part of the reason why the country has managed to flatten the curve is that during the early stages of the MCO, people were quite amenable to following orders because we're quite used to that. You know, you are told what to do and we follow that. But you can only keep it up for a while, because then fatigue sets in and people say, okay, since the number of cases is very low now, and that you can let go. But going forward, I think we have to recognize that we have to have our own realization. We have to realize that what is good for us and what is good for the country or for the state. That we should not be told to follow SOPs and so on. That we should be able to think for ourselves. Then when we do that, we realize that we do not need to be told, for example, to wear masks or to observe physical distancing and in crowds and so on, and to do what we're supposed to do. So I think for the future going forward, we have to have that kind of realization, and we need that. We need people to get this message across so that people realize it that by themselves. I think self-realization is way better than being told. I think, right? That's what I think.
I think I think the point that we're reaching is the ability to internalize these things, internalization of the fact that my behavior has a ripple effect, and we all have a role to play. But at the same time, we are in an environment, as you said clearly from the very first few slides, which says that we are still in this. We're still doing many things that we need to do. Look for the vaccine trial. There are many options. There are many scenarios that we look for. Right. So in other words, learning to live with these things, it's equally important. Observing all the SOPs are very simple because it has a ripple effect. I want to move from there, Prof, to something that that I think will probably excite most of the people that's connected now. We have 122 people in connection at this point in time. Right. It's something that you speak about, which is automation or AI, a lot of digitalization. Right. I think it's rampant. Everybody talks about 5G and everything else. We watched Trump try to trample China on 5G and UK withdrawal of these things. But I want to go into something more fundamental that is correlated to what has happened as a result of the pandemic. Now, one of the things which is obvious is many people are now beginning to face the truth that organizations have resized that may have led to unemployment.
Right.
The other side of automation and digitization is clearly we have to learn new skills. We have to learn new skills. Now, there are two effects to that. One is the pace of how do we change that curriculum. So what do we need to do now to change that curriculum? Number two, I think there is a social issue around what does it mean now for us in terms of work? What's the meaning of work now? Because we can do less or we can do more with less labor intensive versus capital intensive. So maybe the first one, Prof, what is it that we need to do now in terms of our education system? And this is where it relates to my question of do we follow the evolution in our education system or do we take that leap of faith? So maybe on the first part, what do we need to do from an education perspective?
Okay. Long term, I think we need to change the way that we educate our children. At the moment, despite the higher order thinking skills and so on, which is supposed to have been introduced in schools, we are still in the old education system of rote learning, a lot of memorization, which is not good for the IoT and knowledge economy kind of thing. It's not good. It's not good, really, because they don't become creative enough. That's one. In the short term, we have to think about introducing certificate courses or diploma courses at the vocational level, which enables us to exploit this. You do not need to be a systems analyst or a programmer to create new apps and so on. There are many ways to create these apps without knowing very much coding, very much programming. But this is to be taught early. And this be taught early, and you don't wait for the university level to do it. Universities take too long, take 4 years to finish a degree, for example. But you can do this over certificate courses. So these kinds of jobs and the graduates that we have now who are not particularly suited for this, for example, can be reskilled and retrained. So one of the things that the state can do is to introduce 6 month certificate courses for graduates who with diploma and degree, for example, who may find it difficult to adapt to for everything, to switch to this and to become more adept in venturing into online businesses and so on. So that the state can do quickly, short term. Long term, you have to think about introducing higher order thinking skills in our own schools. Don't wait for the universities. By the time they come to the university, it's too late already for us to try to correct it, right? So too much of rote learning, I think, is not good. Personally, I find it very prevalent among our students in the universities. They still expect people to spoon feed them, you know. So it will take time. That's for the future.
Yeah, I like what I'm hearing. I mean, I will certainly connect with my colleague across in Centec on Said. Actually, I think that's the technical or the vocational side of things that we have. But coming back to the second question, then Prof, which is really something that's quite serious at the moment. As I said, organizations start to resize. And as we start preparing a plan that will allow less labor intensive in terms of capital investment, now there is going to be that social effect. Maybe from your experience in terms of, are there research of how countries are addressing this, or what is it that we can pass on in terms of what are the things that we should start thinking about from a civil service perspective? What are the things we need to start thinking about as we begin to replace, as we begin to enter this era of replacing man with machines type thing?
Okay. One of the reasons why Sweden tackle this MCO differently from other countries, they don't have any lockdowns and so on, because they believe that the way their economy is structured will allow them to do that. Of course, they're not entirely right, because without the MCO, without the lockdown in Sweden, there have been too many deaths, and too many deaths which are attributed to COVID-19. But the fact is, their economy is structured along this kind of work from home concept. A lot of for everything. So to move away the economy, you'll have to think of, okay, how do we automate the small businesses and all that so that they can mainly work from home? I'm not an economist, but I would imagine that combining small enterprises together, micro enterprises, into a larger kind of cooperative style business may be a way in which you can move forward. You don't have to try to do everything yourself, so you can buy certain services or goods within the cooperative to reduce the cost, but you can certainly make yourself more efficient and pull the capital together to increase the amount of automation. But like I said, I think the government itself must make this possible through incentives and through the introduction of a fiberization plan for the whole state. You can't wait for private companies to fiberize Sarawak. It's not going to happen. They are looking at high density population centers because you're looking at returns from investment. Fiberization is very capital intensive, costs quite a bit of money to fiberize. But if the state were to do this as a part of its plan and charge subsidized rates for the use of this fiber to the population centers in Sarawak, which are very dispersed, then you can enable these micro enterprises and so on to go into its online businesses, working from home concept, and so on. And it will be good for our own micro enterprises. Our problem is size. They're too small to make an impact. So combined together, they may be bigger. But when you combine together, of course, there are issues about governance, there are issues about capital, and so on. And this is where the state can step in, because the state can help with loans, for example, to grow this, and can help with training to enable online businesses to grow, and can help with training to to ensure that corporate governance among these cooperative micro enterprises to be sustainable. Otherwise, it's difficult. I admit that you need training. If you don't have to train people, you can't expect everybody to know instinctively what to do and how to do such things. But the capital investment has to come from the state. Like I said, no private company is going to do this because the cost is very high to fiberize. But fiberization is essential for everything. You know, e-work, e-business, e-parliament, whatever you want to do, e-state assembly, has to come from fiberization. It doesn't come from 4G or 5G. 4G and 5G is only good for the last mile connection. The switch hubs still need fiber, and the fiber can last for decades. You do not need to replace the fiber. You only need to replace the repeaters and the boosters and the switch hubs at the end of it. So we need to help this. If not, it will be a problem. Then they become more resilient and they become more productive, the businesses in the long run. Like I said, I'm not an economist, but my own PhD is in a little bit of IT. I did health informatics as part of my PhD, so I do know a little bit about IT.
Yeah. Thanks, Prof. I like you touch on something that's significant and dear to many people. I think we often hear in the past, Sarawak is big, access is an issue. I think if anything else, hands to heart, the pandemic has actually pulled out from the drawers the many things that we should improve and should begin to rethink in terms of how we were to seize the opportunity to move to the next level of opportunities created by the pandemic. Access, when you talk about the training, it kind of touched me in terms of how do we allow people to have access to many of these things. Access to training, access to becomes an issue in many respects. So before I get on further, Prof, maybe I want to look across to the people that is online, 123 people in connection. Maybe just to address them. Colleagues, if you have any questions for Prof, please submit them, or I think we can also allow a chat if necessary with Prof in terms of the question. Here is the opportunity for us to actually put across our concerns, put across ideas to Prof, and let's have this conversation for the benefit of everybody else. Yeah.
I see one question about just now we're talking about online businesses. But that one, I think the government has to help. The state has to help. How to retrain them, how to make sure the infrastructure is in place for this to happen. And before people simply try to, borrow money and try to improve, I think they need to be able to know this effectively and efficiently, so that they don't pile up with debts, and they need to do a risk assessment of their kind of business, whether their businesses will be subjected to unknown risks when they venture into online or when they try to automate. So we shouldn't simply rush into a business where the demand is too cyclical. That is, demand is high during a pandemic, but it's not high during other times. So when the pandemic is over, for example, the business will suffer. So that kind of thing will need properly trained economists. I'm not an economist, so I can't advise on this matter.
I think there are two things, Prof, that I think I'm sure is playing in the minds of many people in this forum, in terms of a lot of things that you pointed out, pointing towards the benefit of long-term investment, either by the state on R&D. Research. We probably have done a lot of research in the past, probably in terms of cash crop, the rubber of this world, the palm oil of this world, and a few other things. If they said if there is money now, money is not an issue, where would you put the first R&D for the state, Prof? Apart from the fact that we have the Rampangi, we have the digital economy as part of the program that we have. But as I said, that could be an evolution that we're looking at versus the leap that we have to take. So if I have that money, I have that budget, where is that leap that I need to take?
Right. I would imagine that people will always continue to need food, whether you like it or not, whether pandemic or not pandemic. In the normal economy, you will need food. So food production at the moment, I think, is rather high cost in Malaysia because you use a lot of labor. So we have to look at what foods that we can easily produce that can fetch a higher value. The only problem with that is that such higher value foods tend to be foods which are temperate kind of plants, for example, foods which are high cost to produce in this country if you want to use technology. So if you want to export higher value foods to neighboring countries, something which is not easily perishable and can be exported, you have to study which foods can be done. So, for example, if you want to say, I would like to produce some kinds of temperate vegetables because there is a demand, say, just from ASEAN alone. And ASEAN is near enough that you can transport this relatively quickly to them without it perishing. So what versus the cost of producing such foods in the vertical farm? If the cost justifies it, then we can do it. That's why I said, if you have cheap power, really cheap power near a place, you can do vertical farming very quickly and at low cost. Capital investment is high, but the running cost will be low because a lot of the cost goes into the power, the ultraviolet light which is required, the automated irrigation systems for the fertigation systems for the plants and so on. But those foods can fetch high value. So if we are talking about temperate fruits, temperate vegetables, which can be exported to neighboring countries, because there will always be a population which will require that. So post-pandemic, if we are talking of exporting to Indonesia, for example, Indonesia is a population of 270 million. And assuming that the top 10% can consume this kind of food, that's about a market of 27 million people. So a market of 27 million people will want to have certain foods which they believe are better and higher value and which they may be willing to pay. Philippines alone has a population of more than 100 million. So we are talking about large populations. Sarawak itself is not a big state, remember. We have 3 million in Sarawak. So you have to go for higher value, you have to go for automation, and you have to go for something which you can sell at a higher price post-pandemic.
I think, again, as I said earlier, I think what you said really resonates very well with the state. I mean, under our 12 RMK, agriculture is indeed, as I call it, our smart agriculture. It's an area that we need to move into. And we have an advantage, we have the advantage of our dams and a few other things in terms of the power that you talk about. But I guess it's how we cut and size the plan that allow us to actually move on in terms of doing those activities now. I'm just looking across the my colleagues in the room that we have less than, what do I have now, 15 minutes? Less than 15 minutes. So I do encourage the 119 that's still connected with us. If you have any questions, please to actually post them.
I saw one question about neurological problems, I think. Yeah.
Yes.
Yeah.
Pick it up,
yeah. There's no study in Malaysia about those with neurological problems post-COVID, but we will know in the coming days because we have the task force that I lead on analyzing this COVID-19 has recently obtained, after so long negotiation with the Ministry of Health, to obtain data to analyze. So we will analyze this and see whether post recovery these patients suffer or not from neurological symptoms. So I hope that answers your question. So in Malaysia, we don't know.
Yeah, there is one here. I'm reading a question here that talks about adaptation of technology often requires a high level of training. And I think this is more about are we preparing ourselves to evolve and adapt through this inevitable shift. I think it was one of the things that I've asked earlier, this mindset of ours. How do we, it's about the mindset. Do you want to say a few words again on the same topic, Prof? The question of how do we get prepared for this? It seems to be coming back again and again. But I will twist it towards the end with something else I have in mind, but let's hear from you first.
Okay, I've been talking about higher education thinking skills for many years now. I was the Deputy Vice Chancellor for Academic and International. Before that was Research and Innovation. So we have not done this properly in Malaysia. We have still very exam oriented. We still say that you have to memorize certain things and all that. And yet we do very poorly in PISA and TIMSS, the science and mathematics assessment, which international benchmark used by many countries. Yet in a country like Finland, for example, Finland has 30 years ago changed the entire education system that it had. It went away from rote learning. It went away. It emphasized more on collaborative teamwork kind of approach, thinking rather than rote learning. And it had only one school exam at the end of the schooling period before they go to university. Yet Finland has one of the highest PISA and TIMSS scores in the world, despite not having regular public examinations. So despite not having to ensure that knowledge is fed into the student, they emphasize on the skills of creativity, the skills of looking for information, and that is way more important now than ever before. Our own medical curriculum has changed over the years. During my time, we were fed a lot of information. It was so much. It was crazy. I slept at 2 a.m. every night just to digest the day's classes. So it's but nowadays our emphasis is very different because the information is there on the web, on the internet. Our emphasis is how do we synthesize and look for the correct information, and how do we ensure that they can work together in teams? Because working in teams is the way of the future. It's not working alone. You can't work alone in the future. So no job says that you can just work alone and make a success of it.
I think I would take your last few remarks, Prof, from a leadership perspective. I have to sell the Leadership Institute. It comes from that perspective. I think in all of these things, if we look at it from start to the end, where we are now, towards the end of it, leaders have a role to play, and leaders have a role to play. Now, if in your words, Prof, if I were to say, look, Prof, in 1 minute, what would be the critical 3 things that we as leaders in SCS must start thinking or start doing now? What would that be then, Prof?
Okay, first, I think you got to rethink the state economy, how the state economy needs to move forward post-pandemic, post-oil, because oil will become less important in the future. Fossil fuels will become less important. So you have to think of things that we can invest in, which can make us leaders. One is electric transports. I would imagine electric transports, and with the electric transports, we are talking also about driverless vehicles and all that. Secondly, with cheap power, you have to think about data. Data is the gold mine of the future. So transitioning towards a knowledge kind of economy, data, you can just be data centers, which doesn't make you very much. So there's just real estate kind of management. So if you offer real estate with cheap power, you can automatically attract the data centers. But the third one, which is more important, I think, is that the enabling of data for the civil service as well as for the population itself means that you can explore other things that you can do. So instead of just focusing on things which require high labor costs, for example, we should be venturing into things which can be done by our population, provided we give them sufficient skills and education, which is the service industry. So being a state with only 3 million people, if you want to go for low labor cost or kind of productivity, it's not going to work out in the long run. There's only so much that you assembly style operations that you can have. But if you go to a service, meaning what are kind of services that we can offer? Like I said just now, the obvious one, easy one would be data centers. You got land, you got power, you can set up data centers very quickly. But that's very superficial. So the second one is, how do we get our own people to use data to come up with certain applications or certain systems and all that, which do not require you building lots and lots of factories. So we haven't done that. We have done nothing of that sort. Thirdly, we haven't really done anything on the green tech economy, the green economy, and that's got huge potential. As climate change becomes a very pressing issue, and it is a very pressing issue, green tech becomes more and more important, and green tech has lots of value. So green tech will look at battery production, electric vehicles. Because fully electric vehicles are the vehicles of the future. I cannot see a combustion engine lasting beyond, say, 2050, for example. I cannot see that. So we have to think about moving all this, even though the rest of the country doesn't want to do it. But we have to do it. Because if we jump on the bandwagon early enough, then we will be able to reap these benefits 10 years or 20 years down the road. So I look at it, knowledge economy, we have to maximize this, move into services so that we can maximize the kind of work that we do, which is also pandemic resilient in a way, because you don't really need to work in the office all the time. And we have to go into the green tech part. Initially, green tech part will involve assembly kind of style, but you have to boost up our R&D. And the fourth one, the last one, is to really have to make use of our biodiversity. That is an asset which Sarawak has not used at all. We have huge biodiversity, and this the Westerners are stealing that biodiversity and using it for their drugs and all that, So we really should do that. But it's a long term. Yeah.
Thanks. I think that summary, that fourth summary that you put forward is very strong. I certainly will pick up with my colleague in SBC Sarawak Biodiversity Center. I like the bit around the green tech, and I think that augurs very well with, as I said earlier, in our RMK plan, Sarawak Malaysia plan, that talks about, like I said, smart agriculture and a few other things. And I think the play on data to me is very thing. It summarized a lot of things we've said up front. We should begin to move into this environment of actually not so much creating data centers, but our ability to want to look into the data to help us move forward. There are two different things. I think many of us want to create data center, collect data, but not willing to look into the data.
Yeah, data center is very low level. It's just real estate set up and give them cheap power.
It's more the value that we generate by looking at the inside. So really like those points, Prof. I've just been reminded again by my colleagues that we have less than 10 minutes. There are a few last minute protocol that we have to do. So I will probably ask one more question, and I think we'll call it, we'll stop there. Looking at the question, I don't think we have any more questions on that one. AI. There's a lot of questions on artificial intelligence, I think, and the emotions around the fact that we're looking at the fact that machines will replace human beings, but I guess that's the challenge, that we become the smart human that creates the smarter machine. Probably that could be the way we look at it. But I guess the opportunity is far more than we can think of. One of the things that I'm nervous about, though, Prof, listening to a lot of these things today, is the pandemic is there to stay for a while. In other words, we have to learn to live with it. But there are a lot of opportunities that we have to set up right now. I think from the state perspective, Sarawak is blessed with many things. We have many advantages. If I step back and reflect, we have many advantages. It's our ability as leaders. I look at the 117 and 123 people that have connected this morning. We are the leaders at every level of the strata of the society. We play a role to make sure that we all can actually contribute and start making that small impact right now. There are a lot of big things being said that could probably be played at the state level, but I think there's small things that we can start changing at our own level as well. So I think, Prof, we'll probably have to call it the day here. I've been told it's 4 minutes, 4 minutes, but I have this dying question to ask you, if I can ask you before we call it the day. This dying question is something I've asked every other Sarawakian. Do you follow the English Premier League, Prof?
Not really.
Not really. You don't support any team. You're not supporting any teams in the English Premier League.
Not really. I'm rooting for the worst team in the Premier League, which is Norwich City.
Okay, that's good. That's good to know that you support Norwich, because I think there are plenty of Liverpool supporters joining in today. So I wish them luck. And I'm a bit sad this morning that Chelsea has just beaten Manchester United 3-1. So there goes my day. But anyway, I'll keep happy for the rest of the day.
But I don't really support any particular team. The fact is, I follow Norwich City because I did my PhD in Norwich in the University of East Anglia. So it's a team which is not really in the big league lah. But
well, at least the captain of the English squad in 1966, they won the World Cup. Martin Peters comes from Norwich City. There you have that attachment to a famous club. So I think we run out of our time, Prof, in terms of the time that we have purchased for this event. I think the conversation will not stop. I think there'll be a few others that will want to connect with us again. Now, for the 116 people that's still online, we will actually be posting a QR code. Can you please scan that and do provide us the feedback? And we need that feedback as we go along for the next event. Yeah? So my team will set up the QR code and then please scan it and provide the feedback. Prof, terima kasih, Prof. It was enlightening to hear you speak, and I surely will probably email you one or two. I think especially the fact on the leadership side of events. Yeah, I just need your guidance on the leadership side of the events as we progress along. So I think for now, Any last words from your side, Prof?
Oh, thank you very much for inviting me. It's a pleasure. I look forward to contributing any ideas and all that. If you require them, I'm still around. I'm still working. Actually.
We will. Like I said, the institute or the state will definitely be in touch, and we're still waiting for the QR code to appear.
Right.
And
stay safe, everybody. Stay healthy. Yeah. Thank you.
Okay, I've just been told that, guys, thanks for your participation. We will send you the what's necessary in terms of feedback form. There are about 122 to the 23 actually that have joined us, and we will be looking for your feedback. We can improve. And I think in the same words that Prof has said, stay safe, stay focused, and salam Sarawak Ibu Pertiwiku. Thank you, guys. We'll talk again.